Okay, so I'm going to start by preparing my IV according to the 6 rights. So, right patient, right medication, right dose, right route, right time, and right documentation. And then I'll go to my MAR, check the physician's orders, make sure that I'm starting at the right start time and that I get my infusion rate calculated correctly and all of those things. So then I'll prepare my supplies. So I have my IV solution, tubing, a saline flush, a saline lock, an IV catheter, dressing, alcohol swabs, tape, tourniquet, and a label for my IV bag, and obviously gloves. So then I will take all my supplies, go into my patient's room, identify them using 2 patient identifiers, so name and date of birth. And then I will perform hand hygiene and get all my supplies ready by the patient's bed. So I just need to open, maybe, there we go, open that tubing, throw that away, and then we'll open our tubing here. Okay, and we'll clamp the roller, clamp here, get all this straightened out, make sure it's not tangled up. Okay. And we'll take this off, as well as this. Puncture our IV bag here. Okay, and then we'll hang our solution on the IV pole. Okay, and then we'll fill the drip chamber about halfway ish, or just to the line on it. Okay, perfect. Okay, and then we will undo our roller clamp here and prime the tubing. Okay. Goodness, maybe. All right, there we go. Okay, we'll hang this up. Okay, and then I will use a label to identify the IV bag with patient's name, the date, my initials, the start time, and the completion time. Okay, so we can get that out of the bag here. Great. I'll make sure the patient's comfortable. Put a linen saver under their arm before we get started here. Make sure the bed's at working height, all that kind of stuff. And then we'll apply the tourniquet here about 4 to 6 inches above where you'll be inserting the IV. So then you'll palpate their veins, check their radial pulse, make sure that you can still feel it. And if you can't, you need to loosen your tourniquet and reapply. And then find a good vein, preferably the most distal one, that has good rebound. And then you'll loosen that and put on a pair of clean gloves here after I get my tape ready. You'll also want to label the IV tubing with the date and the time and your initials. Okay, then we'll put on some clean gloves here. Okay. And I'll get all my stuff opened up and ready to go. Okay. There's that. And then I would open a new saline lock, but I don't have any other ones, so we're gonna pretend. Saline flush up. Remove this. Pull it back, get all the air out. Perfect. And then we will hook it to our little saline lock here, remaining as sterile as possible this whole time with this stuff. Okay. And then I will reapply my tourniquet here, make sure it's nice and tight. Okay, there we go. And then we'll clean the site. circular motions, working our way out as we go. Okay, there we go. And you want to allow that to dry completely. So we'll uncap thing here. Make sure we're good to go. So you want to insert it bevel up, and you'll pull back on the vein below where you're going to be inserting it. And then you'll advance the needle. And once you see flashback, you'll want to advance just a little bit farther. So there we go. There's flashback. And then you'll retract the needle. Advance the catheter. This. Okay. And then you'll slowly administer your saline flush here. Okay. Go. I'm gonna remove this. And place a piece of gauze under there. There we go. And then you'll want to take, okay, and dispose of your needle in the sharps container. Okay, and then you want to take a piece of tape that I should have gotten ready before I started this process here. We'll go under like that. Like over the top to secure it. Secure it that way. And then you'll put one more over it here. Okay. Just like that. And then you'll take your, oh, I got a piece of tape stuck to me, there we go. And then you'll take your Tegaderm, and we'll, okay. Place it just like that. Okay, and then you'll label this with the date and time and your initials. And then we'll hook up our IV solution. Okay. And then you'll undo your roller clamp and establish the drip fractor according to the physician's orders. Okay. And we'll clean up all of our supplies. And make sure that you leave the patient in a comfortable position with their call light, all that kind of stuff. And then we will also be sure to come back, double check the drip rate every hour, make sure the IV site looks good, the line's patent, all that kind of stuff, and be sure to document everything as you go. And yeah, I think that's all I have.